Hey, folks, we apologize. We heard some static on that first segment there. A bad mic cord, like I said. Apologize. We're going through using some of the older equipment this morning till we can regroup Monday from breaking down from the games. Dr. Whaley, we're powering through. Is that what we call it?
Powering through, yep.
It's time for Ask the Doc with Dr. William Whaley. We always want to thank Georgia Cancer Research Center affiliated with Northside Hospital. How are you today?
Good. You see my fancy shirt, huh?
Rise above cancer, mountain strong. I love that.
You like that? One of our.
Why is that your fancy shirt and not my fancy shirt?
Got my name on the back. See,
that's why.
Like
That's why I got
like the baseball players or something.
There you go.
So everybody in the office is wearing this today. If I'm not mistaken, I don't ever remember anything, but I think one of our patients came up with that logo and came up with the Rise Above Cancer thing, and so we made these for our staff, and they're all wearing those today. The Northside Hospital Cancer Center in Blue Ridge, Georgia. So anyway,
Rise Above Cancer.
Rise Above Cancer.
Okay, I have the first Ask the Doc. Now I have, in all of our years, I've not really come. I have doubled down on some of the questions because when we touch on some things that I experienced, but I've never really had my Ask the Doc. So this morning is my Ask the Doc.
All right.
Got it? What do I do this weekend to try to heal up, feel better?
Interestingly enough, there's a really
because I put about 30 hours last week on my morning shows. It's just strict broadcasting. Close to that this week.
Plus baseball.
Yeah, absolutely.
Okay, so I used to do the Omni and Phillips Arenas entertainers, Michael Jackson and all of them, and so they get bad voice fatigue. And so the speech therapist would tell you when you're not doing this, either don't speak or whisper. So you're going to whisper when you're talking to your family, and they're going to think you're nuts. But as long as you're not doing this for the whole weekend, just voice rest.
You do realize when you said they're going to think you're nuts, Lonnie looked over and smiled like, really, that's what it's going to take?
And the other
him telling you to not speak, good luck.
No,
that's true. I thought you were laughing when he said they're going to think you're nuts. You were like, really?
Well, he can whisper. And the other thing is, because of the pollen count, although there's no allergy question today, make sure you're taking your over-the-counter, because that'll keep some of the...
Because a lot of our broadcasting was outdoors this week.
Yeah, no kidding. Until dark night last night. Yeah. Okay. One more thing. You said that Trump went in and said China, 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 and he was looking for a plate, and he was looking for a plate just to put his toast on, and then the market went down.
Yeah, exactly. Right. No. The Washington Post broke the story with a source.
Yeah. Right. Well, the other thing was we're using much less coal to generate power in this country. And he went and seized a North Korean ship that had coal on it. You see, because he told those guys don't mess with me. So they fired some holiday 4th of July rocket up in the air and he snatched one of their ships.
We have known that they are transporting coal against what we put sanctions on, and he said we're going to stop this.
That's right. Light your 4th of July rocket and I'll snatch your ship. And the other thing was that the New York Times looks at this and says Trump is having the same difficulty with diplomacy that all of the past 4 presidents have had. And he's sort of lumping him into the lack of success that Obama had and that Bush had. I don't believe that that's true a bit. I think he's got the Chinese rattled in their boots. And I don't know about young Ching Chong or Rocket Man or anything, but snatching their ship will get their attention. Anyway, that's got nothing to do with Ask the Doc, but I'm still saying he's carrying a big stick.
Okay.
Teddy Roosevelt,
Teddy Roosevelt. The Bull Moose Party.
Bull Moose, right.
What it was? Is that what it was?
Yeah.
The Bull Moose?
But that was after he'd been president, when he came back 8 years later to run, and that didn't work. That was a third party, and it was...
Is he not the president that built the Panama Canal?
Oh, yeah, he's the president, and the Great White Fleet that he took and sewed the ship. He put Howard Taft, who weighed 340 pounds, and his daughter, who was just a ball buster, she was 21 years old, and sent them to Japan and China and all around the Pacific, and who ever heard of the United States, and then came this huge white battleship and everything, and he showed the flag, and he was
the head
first
of the
one.
Navy, wasn't he not? at
Yeah,
one
but he
time?
was, yes, he was, and so was Franklin Roosevelt.
Yes.
But anyway, he's the one that, he built the Panama Canal. He said, talk softly but carry a big stick. And then he built that big white fleet. The English dominated the seas then.
Yes.
And the English wondered too, but when he went to Japan, which was feudal at that time with that huge, great big old ship, and then off walks this 300 and something pound bear of a guy who was Taft, wasn't the president, but he liked Taft. And Taft anyway, it's great. It's a great book. You ought to read it. The Great White Fleet, The Trip to Asia.
I'm going to have to do that.
All right.
You have
Anything to do with testicular cancer, you think?
I was thinking that right now.
Well,
so.
testicular cancer, we're talking about the president. That does have something to do with the testicle part anyway. Right, go ahead. Wait till you see our slides today. You're going to get a kick out of it. Go ahead.
I am 49-year-old male, and I have been diagnosed with testicular cancer. My family doctor has sent me to another physician, and I am being told I have a choice on a treatment and surgery. Is there a cure for testicular cancer? What's the best course of treatment?
All right. Well, we got pretty good here. We got the patient's age. We got the organ. But we didn't get the type of testicular cancer. So go ahead and show that first. This is a 3-page thing. We don't want to scare everybody, but this is just so that everybody will see that there are 3 pages of this thing, and there are 6 different types. It's sort of like if you got a peach. You could have the peel could have cancer, the meat could have a cancer, the pit could have cancer. But anyway, so there are 2 major types of cancer. Seminoma by itself, and all the rest of these are called not seminoma. Now you can take that off there a minute and put that next one up, and I'll come to it in just a minute. So you'll remember when we talk about lung cancer, we talk about non-small cell lung cancer, which is 10 different types of cancer, and small cell lung cancer, which has a specific behavior. So seminoma we're going to talk about this cancer as being a non-seminomatous cancer, but more importantly, what this tells you is something we have not talked about on here before, and we'll be as gentle with it as we can. We talk about the breast cancer and self-examination and mammography. So pull up the one with the walnuts here.
Okay.
Well, you're going to love this.
It's not every day I hear pull up the one with the wall.
Well, all right, but this is.
I get it.
This is a
right.
national. This is a national.
This is a serious question.
Awareness. National awareness campaign that went on about 18 months ago. So it's a little bit late, but that's where this picture comes from. Testicle for young men was being taught in school. Women have always heard about self-examination of the breast, but nobody's ever talked about self-examination of the testicle. So this particular slide shows a guy who's got 2 walnuts. That's you know what the figure is, and then he's going to take one walnut and carefully feel it to see if it's the sizes are the same, the shapes are the same, and the composition is the same. Now go to the next one here. So this picture shows basically how the guy would do it. And what you're going to see on the left-hand side is you've got one of these that's much bigger than the other one, or one of them that seems to have a marble or a grape in it that's not on the opposite side. We're right back to where we were with mammograms. You remember I said if you have your right hand should look like your left hand, only a mirror image. How many times you heard me say that? Your right eye should look like your left eye, only a mirror image. So if those 2 walnuts are not a mirror image of one another, we don't have a mammogram you go see your doctor. And then there are tests, blood tests and ultrasound tests and so forth to tell you what to do next. Now get up that next one here because I think this is real important. Testicular cancer is virtually 100% curable, which I'm going to come to in a minute. But there are risk factors that are sort of important. One of them is that there are a real measurable number of people who, as boys, between the time they're born and the time they get to 2 or 3 years old, both testicles do not descend into the scrotum. They only have one, and the other one remains up in the canal somewhere. Rather than ignoring that testicle has to either be surgically lowered or removed, or that will become a testicular malignancy. Now look at the bottom right-hand risk factor. What's that one right there?
Marijuana.
Now we just legalized about half the states in this country one of the risk factors for testicular cancer. Now you heard me talk before that everything about marijuana has not got to do with just pain relief or nausea or impaired driving, but it is a known risk factor for testicular, ovarian, and other malignancies. So let's get rid of that one. Now, I want to get a picture of the most famous guy, but who is the most famous guy that's had testicular cancer and made, we've talked about him many, many times, that, go ahead. Lance, okay, Lance Armstrong.
Lonnie said, "I finally got one of the questions."
So we're not going to do Lance. We're going to do another athlete. We're not even going to. But here's a picture for Pittsburgh, right? He gets testicular cancer. He's pissed off about having testicular cancer. It's a big deal.
I thought it was because he was batting .213.
Well, no, but he's a pitcher, though.
Oh, okay.
As a matter of fact, our pitcher here for Fannin can bat also.
Absolutely.
We won't get back into that. So with Lance Armstrong and with him, surgery's done. He's out of baseball for several years. Tragedy, everybody talks about it. But the big triumph is he comes back, and I don't think he won the Cy 1 award, but he's the top pitcher for the Pittsburgh Pirates 3 years later, just like Lance Armstrong. Now, if you remember Lance Armstrong, and went to Indianapolis, Indiana, to my buddy Larry Einhorn, and Larry Einhorn gave him what's known as the Einhorn regimen and cured him of testicular cancer. Now let's go to that next picture. All right, here you go. You ready? What's that cure rate right there?
100%.
100%. Most testicular cancer, which is in this category, is got 198% cure rates. That's the question that's asked today specifically. What is the best course of treatment? Now, it depends on whether it's the seminoma or the non-seminoma, but it makes no difference. Testicular cancer in its aggregate is 198% curable. Now, if it has recurred like Lance Armstrong's did, and it gets in the liver and the lung and the brain, which is the minority of cancers, it's still 80 to 100% curable with aggressive chemotherapy. So this is one of the cancers where we can say we can cure it, that if you can pull those off there. If there's a early detection mechanism, which would put you back into the, you want to detect it in the early stage, since that's 100%. Now the next stage, where it's already in the lymph nodes up in here, it's 98% curable, but still you want to catch it as early as you can. So we try to teach, and I'm not sure whether they teach this now in our local high schools in their health classes, but self-examination of the testicles should start in the teenage years by boys and then go on forever in men. This is primarily a disease of young people. But I've got a guy I saw in my office 2 days ago who is a 96-year-old Korean War veteran, and he was diagnosed about 15 or 20 years ago, so he was in his 70s, and he's 100% cured, and he comes in every once in a while to say hi. But it is a disease that can occur in people at any age, but it's more common in the young age than in the older age. And to answer the question, the best course of treatment is early diagnosis. The treatment for the tumor in the testicle is not, this is one place we don't biopsy. we remove the testicle totally, and then from that testicular removal, you're going to know if it's a seminoma or a non-seminoma. They're going to look with scans to see whether it involves lymph nodes or it's spread. And if it hasn't spread anywhere, a number of those people will just be observed. If it's in the lymph nodes, you'll get chemotherapy, and it's 98 to 100% curable. Is that enough?
Yes, it is. And I tell you what, a couple things in that question. Age, male. Dr. Whaley always needs you to give him as much detail as possible, and so he, as you can see, so he could drill down and get you the answer, the best answer he can, and that was great information.
Right. Cell type would have been nice, but actually it was good to talk about both of them, because the non-seminomatous ones are the ones that get chemotherapy, and seminoma is so sensitive to radiation therapy, you can just about shine a flashlight on it and get rid of it. But anyway, between the two of them.
Lonnie over there thinks he's on Jeopardy, so Lonnie, the answer was, who is Lance Armstrong? Sorry. I had to give him the beep beep, and he lost his $400 there. $400, Lance Armstrong. All right.
Oh, is that guy still winning?
I don't know if he's still. I didn't.
He tested positive for enhancements.
No, I'm talking about the guy on Jeopardy or whatever it is.
Really? So the guy on Jeopardy tested positive for performance enhancement drugs.
No, yeah.
I need that.
Yeah,
Let's move on.
I know about Lance. You haven't been here for the last few weeks. We talked about Procrit and things to keep your red count up, and that's what he raised for 7 years before they could test for that drug, and then after they learned how to test it, they had eight of his urines on freezer, and they went back and all of them were positive, and they snatched everything away from him. I was talking about the Jeopardy guy. It is Jeopardy, right?
Yes.
That guy that's won a long winning streak here, that got
Yes.
millions.
I've
never watched the program, but everybody around my office keeps watching it. So we'll get on here.
Again, thank you, Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. Our second question: I am 37-year-old man, and I am HIV positive. My question is regarding lung cancer, though. I am told I am at a higher risk. Is lung cancer more common among people with HIV than those who don't have the virus?
Well, the answer to that question is basically no to any reasonable amount. We're going to grab that great big one there that'll scare everybody first. These are the malignancies that are associated with immunosuppressed patients. Now, the most common immunosuppression we have today is HIV, but kidney transplant, heart transplant, and transplanted patients are also immune suppressed. And if you look at the classes, most of them are in the lymphoma category. Then some of them are cutaneous, Kaposi sarcoma, I'll show in just a minute. But there are 3 pages worth of these things, and you'll notice that when you get down here to the lung, respiratory tract, it's really basically the same amount of occurrence as occurs in people who do not have HIV or transplantation. It's higher, but not a great deal higher. So go to this one. There's 2 different things here, and I'm so glad we have this question, because this patient is HIV positive. But in this day and age, what's this say here?
Cancer risk in AIDS patients.
All right. He's going to be like Magic, right?
Right.
Magic Johnson.
Right.
How many years is that? How many years has it been since Magic has been known to be HIV positive?
15 maybe now?
15 years?
Yeah.
18 years?
Yeah, it's been a long time.
That's right. Okay,
except maybe 20.
It might be 20. Except for the side effects of the drugs, which somebody who is aware of the side effects of the drug can tell by looking at Magic Johnson. He has a little bit of a never mind, I'm not even get into that. But Magic Johnson is normal as the rest of us taking the drugs. But here you've got that next little chart up over there. Okay, so AIDS defining cancers are Kaposi sarcoma, non-Hodgkin's lymphoma. You notice all of those are lymphomas. And then down at the bottom is cervix cancer, what we talked about last week, right?
Right.
HPV-related cancers. And that's because HPV was related to the behaviors that are associated with HIV. But it's way down the list after lymphomas. Now show that last picture. We'll have that up for a minute. Back in the day before we had the medications for HIV, it was not uncommon for a physician who knew what he was doing to be on a subway or be walking down the street and see somebody that had these lesions on their face, their neck, or their arms who might not even know that they had AIDS. And this kind of purplish looking, it's in color on what he's showing over there. This purplish looking thing is called Kaposi sarcoma, and that was an HIV defining condition, and that if you had it, then your cells that are immune were down to almost zero, and in the day before we had HIV treatment, then those patients would survive only a short period of time. So we don't have that anymore. It's a really great question, but being HIV, worrying about lung cancer, yes, you shouldn't be smoking. You should take the HPV vaccination we talked about last week, but the other malignancies that are defining for AIDS associated with HIV are going to be very, very, very low in incidence compared to when we had AIDS, if you are under vigorous AIDS therapy, and that's available to everybody in this country, whether they have insurance or not. It's free in public health departments, and we're even shipping drugs to Africa and other places in the world. So basically anybody with HIV infection in the world should be able to get treatment today to prevent AIDS. Is that enough?
That's enough. Ethan, do me a favor, that jersey right there next to you, throw it over here to me, please. All right. Now, let me see that. I don't want anybody to see it yet. Now, I said to you, I love that shirt, and you said, check out my shirt, and I said, hey, how come it's not my shirt? You said it's got my name on
the
it,
back,
right?
yeah.
Check out my jersey. Check us out, all right? You see that? Rebels jersey, right?
I do notice
You see that? You see that?
I do.
You like that?
Yeah.
And that's
And that 30 is your waist size, right?
Always with the weight size. But
Well-
here it is, Dr. Whaley. I got to show it off.
It's beautiful.
That's my.
Now, did they give that to you last night, or have you
Well,
had it for a
no, they
while?
gave it to me earlier in the year, but
Well, you deserve it.
I appreciate it. Thank you very much.
You deserve it.
Okay, so don't get me on baseball. That don't.
No,
you
no,
know
no,
better
I
than
won't.
that.
No. We got
We'll wait for Jane to talk.
that
about
is why I brought that testicular cancer guy, though,
Absolutely.
as a baseball guy instead
great
of Lance
example.
Armstrong. We got a couple of basketball players I could have used, or football players. So that's why I got the baseball player.
So what in the world of medicine out there?
Okay,
and
here's-
health and fitness and all the above.
All
is
right.
going
Well,
on?
here is the list of stuff. Here's the list of stuff from this week. Here, let's look at the second one on the list. What's that say?
Do adults need a measles booster shot?
Now, I was born way before 1957, so I had measles.
Wait a minute, Jane, listen up. I was just doing his part because he's about to look at you and say, "No, listen."
I was born way before 1957, and my immunity to measles is called natural infected immunity, and I am not going to get measles.
You had them.
I had them.
Okay.
Now, but the first few years,
And that's the natural infected
having an infection.
immunity.
All right. The first few years of measles vaccines were not effective. So those people from 57 to 62 who got their shots, and when they went to college, got another shot. But if they didn't get another shot, their measles shot didn't work. Now we're talking about people who got the proper series of measles shots, who are now in their 50s, 60s, or 70s.
Wait a minute. I got to ask this.
Yeah.
I'm not giving away age, but 1969?
1969, yes. You would have been immunized with what was considered to be a good measles.
Okay.
All right. Now, there is no recommendation by infectious disease people that you get a booster But there are so many people that don't know if they got the second shot or not. They don't, the pediatrician's dead. They don't have a shot record. So in Manhattan and on Park Avenue and in Los Angeles and all of these wealthy communities, people are rushing into their doctor and saying, am I immune to measles, particularly if they travel. So if you're a traveler like we are and you're overseas a lot, we're going to be going to Russia. That's where you get measles more than you catch it here. We got 800 cases already here in this country. So they're doing blood tests. The blood test costs, let's say it costs $75, and it comes back you have no immunity to measles. Then that means if you had the shot in the past, your measles immunity's gone away. And so they say, okay, give me a measles shot. Well, measles shots are cheap. So what the recommendations are now is that if you are nervous in the service and just scared to death, it is cheaper to get a measles vaccine as an adult than it is to do the blood test to see if you're immune or not, because there is no contraindication to an adult taking a measles shot, because there's never been anybody who suggested that an adult got autism at 60 years old by taking a measles booster. So that's number one. We got that one?
What's that background noise?
I don't know. I can't tell exactly what it is. And then I'll just hit the last one right here, because we always have to talk about, what's that one say?
Pre-pregnancy weight matters most for complications.
Oh my gosh, here we are again.
I'm pregnant.
No, you're not pregnant. People who
I have no control, folks.
have no control. Well, I'm trying again to get to this point that 40% of American females over the age of 14 are obese. Huge number. That number was zero in 1945, 50. And that's the biggest risk factor for complications of pregnancy. Amazing, isn't it? And you think of all these other things going on, so it's my plea again to control kids and control their weight. And I was just kidding about the waist size in the jersey there.
I got one more thing.
Yeah.
How long? And I know this I know this is off the. I just gotta ask this: how long should bruises last? A bruise.
How big is it?
How long? This big.
How big is it? How deep is it?
Don't know. But
Okay.
It's pretty black.
Okay, it can last for weeks.
Okay.
All right, I ran to Boston.
The only reason I say this is I don't care. Everybody out there knows we were doing the broadcast, and for 2 weeks I think I climbed up and down a ladder, no exaggeration, 50 times, on top of a dugout, climbing over stuff, and I got a couple bruises.
Okay. No, they'll
I
go.
just
They'll go
wonder
away.
how-
I tore my hamstring and ran the Boston Marathon on a torn hamstring, and it took about 3 months for the blood that ran down my foot to the sole of my shoe to go away. Now, if you get one of these little bruises on your arm because you're loading firewood,
Right.
that ought to be gone in a week. So it depends upon the depth of the hematoma, the volume of the blood, and the location. So that if it's in the lower extremity, and you're hinting that yours
Yeah,
are in
right,
your
yeah.
thighs, then if there's a lot of blood in there, it's going to leak its way down, and the back of the knee is going to be green. It's going to go down in here. Just don't worry about it.
Well,
It'll go away.
If you believe it or not, I've never really asked the doctor this question. What is a bruise?
Okay, bruise is blood.
Really?
So-
Okay.
so you
I
got-
mean,
you
I
got-
know that, but I mean, I
Well,
just like
yeah, when you
what
get it-
creates a bruise?
Okay, well, you have to tear something, or
Okay.
So when we're talking about athletes, you're talking about a torn hamstring, you're talking about a torn joint. Now you're talking about a kid sliding into base that gets hit in the shoulder with the ball. Then that ball hits the capillaries. Those capillaries leak out a little bit of blood. That doesn't go very deep. You tear a muscle and bleed, then you bleed a lot. You're bleeding deep into bleeding deeply, and that takes much longer to heal. So the kids that got hit last night in the shoulder with a pitched ball, or they slid into base, those bruises will be gone in a week.
Thank you very much, and I always appreciate you letting me ask all those questions. I had a lot of them today. I'm working here. You've answered.
What did I say to do about this? Whisper. Y'all
So
guys,
what
if you see
no,
him,
what you really said is all weekend long. I
Voice
just won't
rest.
talk.
Don't
At
talk.
least he'll say, how come you're not answering? Dr. Whaley said,
I am answering. I am answering. I am answering. Whisper.
We want to thank Dr. Whaley always for this segment, Ask the Doc, brought to you by the Georgia Cancer Research Center affiliated with Northside Hospital. Folks, if you have a question for the doctor, you send that to us at info, I-N-F-O, at fetchernews.com. Put in the subject line there, Ask the Doc, and as he always says, if you'll give us some age, a little background, any kind of medical information of history that you can give the doctor the more detail in answering the question. So you send that, and also if you want to send this segment to your friends, you go to FYN TV Fetcher News YouTube channel. You check on the playlist, Ask the Doc. You can forward these to your friends. And while I'm on a roll on that, we do get all of your questions about allergies. We understand what's going on, but we want to tell you, instead of continuing to bring them up to Dr. Whaley, if you'll hit the playlist, we have probably 3 or 4 very good segments. If you're suffering from allergies, I know a lady that did not realize that you could get the eye drops.
Oh, yeah.
And after the segment started using the eye drops and is thankful. So those things like the allergies, the questions that come up seasonally, you can always search and not wait for Friday, Ask the Doc, and we've got so many answers for years to so many of those questions. Again, I'm your host, BKP.
Wait a minute, I got one more thing.
What you got?
Well, we're inside today because of the rain, right?
Yes, sir.
Okay, and I watch the rain every year, right?
Right.
Between the year that ended on April the 30th, which is just, 10 days ago, is the highest rainfall in the United States in the last 120 years.
Wow.
Now, the drought, portions of the country that are in drought now are down to just a little tiny bit. So I'm the one that says, quit worrying about climate change, because when it was all the drought, all the tree huggers were telling us it was because we had put something in the atmosphere and the rain had gone away. Well, rain came back, and I'm happy to see it, and it's got nothing to do with climate change.
You do know I'm trying to pay attention, but looking over this way, I can't get that TV screen.
Isn't that a great picture?
Oh my!
You see that trout on that
That's
screen?
exactly about the time you say something. That trout will come.
That's right. That's a great picture, isn't it?
Folks, we're at Circuit World here at Blue Ridge. Again, Ask the Doc, Georgia Cancer Research Center affiliated with Northside Hospital. And also, when you find this on social media, if you want to put questions there, we've been going through the social media getting your questions. Get them in, Doc will answer them. When we get back, we'll get this amazing panel. They're the all-star political. I don't know if we ought to add the word amazing. I mean, yes, they are amazing group over here waiting. Now, Rick, I'm going to just jump out. He doesn't know a lot going on this week. I guess I say for him.
He's been in baseball too, though.
Yeah, he knows what a good curveball looks like right now. So Bruce is pulling the show. Bruce on one side and Jane on the other when we return.